today we have the wonderful pleasure of having Chantal Wahteeshkin with us. Chantal is an Indigenous, or was an Indigenous nurse navigator at Cancer Care Manitoba, and is now moved into Indigenous Health Director role, I believe. And she is going to talk to us today about those roles and, of course, how they relate to equity in cancer care. I've known Chantal for a couple of years now. I'm not sure how many years. And it's been a real pleasure to collaborate with her in some of the projects that are ongoing. So I'm going to turn the floor over to Chantal to tell you a little bit more about herself and the work that she does.
Okay, thank you so much, Dr. Horrell. Let's see. Hopefully, I got the hang of this now. Uh, Open that, and then there we go. So everyone can see my slides.
We sure can.
Amazing. So hello, Anin, Bonjour, hello, good morning, or afternoon, depending where you are. My name is Chantal Wahteeshkin, and I am the Director of Indigenous Health at Cancer Care Manitoba. And I'm here to talk a little bit about the role that I held before this and a little insight into my current role and advancing Indigenous health equity in cancer care. So, thank you for having me. So a little bit about me. I am Anishinaabe from Nemetsazagin First Nation in the Robinson Superior Treaty Territory of what is currently known as Northwestern Ontario. And I am also proud to be Red River Métis from Saint Laurent, Manitoba, here on Treaty 1 territory and the homeland of the Red River Métis Nation. I also work and was born here in Winnipeg. The photo on the top left-hand side is an aerial view of my home community of Nemetsazagin. And the photo in the middle is of the St. Laurent sign outside the Welcome Center and post office. Uh, I am a registered nurse by training. I graduated with my Bachelor of Nursing from the University of Manitoba back in 2022. And my decision to pursue a career in healthcare was, I would say, a very deeply personal one. So this is a photo of me at the age of 5 in my home community of Nemetsazagin to provide a little context to how I grew up, at least in my early childhood. As you could see from the photo on the previous slide, my home community is very small and remote. And at our peak, I would say we had probably 150 people living in community. So you can imagine everyone knew everyone. There were no secrets. And we have no roads in our community. Primary way in or out of the community is by train, which I don't know if people could have saw from that photo. It's not great quality, but there's train tracks that run through the community at the top right-hand corner of that picture. That very clear line is actually train tracks. Um, so most importantly about my community, we have no immediate access to healthcare. So no nursing station, no health center. Quite honestly, the best we have is someone trained in first aid. And I was around this age in the photo when I fell ill one evening. My parents were young and terrified, unsure of what to do with their sick 5-year-old daughter in a community with absolutely no health care. And so they did the only thing they knew to do, and they called an elder in our community. The elder came to our home, took one look at me, and told my parents I would need to be medevaced out of the community to the nearest hospital, which was a 3-hour journey away. And so the medevac team was called. When the team arrived in their helicopter, they strapped me to a stretcher and then dropped a bomb on my parents and I. My parents would not be allowed to travel with me. They were told that they would have to call someone in the community in the city that they were flying me to come and meet me at the hospital. Panic, fear, trauma. Those are just a few of the things that my parents and I experienced in that moment. And it's an unfortunate reality that many Indigenous peoples across this country face when it comes to accessing healthcare. While that experience was deeply traumatic for me and my family, that day lit a spark inside of me that years later would become my passion for affecting positive change for my people in a healthcare system that was not designed for us. In Canada, we see that cancer is now among the top three causes of death for First Nations peoples compared to non-Indigenous Canadians. First Nations peoples face significantly poorer 5-year survival rates for several common cancers, including colorectal, lung, breast, and prostate. Inuit are at very high risk of lung and colorectal cancers. Inuit life expectancy is 13 years shorter than that of non-Indigenous Canadians, and cancer is the single greatest contributor to that disparity. When we look at the Métis, cancer incidence in Métis women has been found to be higher than non-Métis women. Métis peoples present with higher and increasing rates of lung, liver, breast, and cervical cancer than non-Métis Canadians and have lower survival rates for prostate cancer. One thing that I do want to note and point out is that all of this data, with the exception of one study, are at least from several years ago. And as such, they likely do not reflect the current nor projected landscape of cancer among Indigenous peoples in this country, which is quite frankly terrifying. In Manitoba, specifically, where I live and work, we have the highest proportion Indigenous population of any province in Canada at 18%. And thanks to a study published in 2019 conducted by Dr. Horrell and a wonderful team of people, we do have some Manitoba First Nation specific data, which shows an increased incident rate of colorectal, cervical, and kidney cancer. Higher proportion of late stage diagnoses, so those stage threes and stage fours, and a higher all cause and cancer specific mortality. Became clear that something needed to be done. And this is where the Indigenous Nurse Navigator role came to be. The Underserved Populations Program here at Cancer Care Manitoba has partnered with First Nations, Inuit, and Métis communities for many years, including making space to amplify community voices and identify First Nations, Inuit, and Métis determined actions towards enhancing cancer care across the continuum. It was from those partnerships that First Nations, Inuit, and Métis peoples identified the importance of the role of a navigator supporting Indigenous peoples. And Cancer Care Manitoba aimed to respond to that Indigenous determined action, as well as directly respond to the Truth and Reconciliation calls to action for health, specifically I believe it's I, which calls for increasing Indigenous professionals working in healthcare. Took some time, not gonna lie, to create a job description and get union approval. But thanks to the work of a few dedicated and determined people here at Cancer Care, this was done and the job was posted. And in March 2024, so over 2 years ago, I was the fortunate person who got to step into this groundbreaking role. It was the first of its kind in Manitoba and one of the first across the country. So, what is the Indigenous Nurse Navigator? The way I like to explain the role very simply is it is supporting Indigenous peoples from an Indigenous perspective. Very ambiguous, I know. But the Indigenous Nurse Navigator role is designed to support First Nations, Inuit, Métis, and urban Indigenous peoples across the cancer continuum. Ideally, this relationship begins at the point of high clinical suspicion of cancer through diagnosis, treatment, survivorship, and or that transition to the spirit world. We really wanted to make accessing the Indigenous Nurse Navigator as low barrier as possible and empower relatives to be able to reach out themselves rather than needing a referral from a healthcare provider that most either don't have very limited access to, or quite honestly, don't trust. That said, referrals from healthcare providers are also still accepted. Um, Support continues through the diagnostic phase, either by coordinating diagnostic testing and the minimum required investigations needed to be seen at Cancer Care Manitoba with the person's own primary care providers, or by liaising with our family physicians in oncology at Cancer Care for those who don't have access to primary care providers or have inconsistent access to one. When it comes to the treatment phase of the journey, the Indigenous Nurse Navigator role shifts to becoming a bit more about advocacy, ensuring that relatives' wishes, goals, and beliefs are honored with their care. It's no secret that the first appointment with an oncologist is overwhelming. Information often goes in one ear and out the other. I often would make myself available to attend those first appointments with relatives to not only be there to advocate for them, but to be available after as well, whether that was a day later, 2 weeks later, when they would come back to me and say, you know, I didn't hear a single word that doctor said. I just heard the word cancer and everything else was a blur. And then be able to break down the information in a way that might be better to understand, or simply when they're ready to receive that information. In survivorship, a lot of the Indigenous Nurse Navigator role was ensuring that follow-up care is coordinated. This is often a very complex process for those who live in remote and isolated communities where access to primary care is fragmented or simply not available, especially if they're being discharged from their oncology clinic. It becomes very easy for recommended follow-up care to be missed. Additionally, that transition out of active treatment is often an emotional and fear-inducing one, So, ensuring that relatives are connected to resources like psychosocial oncology or support groups was paramount. And when supporting relatives transitioning to the spirit world, my role was more of what the relative and their loved ones needed. That was my approach with every person I supported at any stage in the journey, but even more so during that time. It could be something as simple as connecting them to their palliative care coordinator because they misplaced the number, or coordinating connection to supportive resources to help alleviate some financial pressures during that time. And if needed or requested, continued support for their loved ones once the relative has transitioned to the spirit world and joined the ancestors. The Indigenous nurse navigator role is truly about walking the journey with them holistically. I know I just gave a bit of an overview of what the work looks like through the cancer continuum, and I think it's suffice to say that no 2 days ever truly looked the same. In order to serve as many relatives as possible in varying geographic locations across Manitoba and the Kivalliq region of Nunavut, the Indigenous nurse navigator role, like all nurse navigators at Cancer Care, is virtual, meaning most support is delivered at a desk over the phone. I could be reviewing and or consulting with FPOs to order diagnostic imaging, blood work, testing, or I could be conducting new intakes or checking in with relatives I'm already supporting over the phone. Sometimes I would be attending appointments in Winnipeg with relatives. Most of the time, and most frustratingly, I could often be found on the phone with non-insured health benefits or NIHB, trying to coordinate travel and logistics for Status First Nations and Inuit relatives coming to Winnipeg for appointments. Often involved about a good hour or two spent waiting in queue to speak with a representative. Other times I could be advocating for relatives and connecting them with resources. And on the odd occasion, I would be invited into communities to deliver education sessions to community members. And that is what that photo is there. It's from an event called SASH, which was designed in partnership with the Manitoba Métis Federation's Health and Wellness Department to deliver some cancer education to Red River Métis citizens. So that was a very special event for me to attend. These are just some of the common barriers I witnessed during my time in the Indigenous Nurse Navigator role. And obviously, this is not meant to be an exhaustive list. I saw the barriers that I'm sure a lot of us see and are aware of, like transportation, financial concerns, caregiver requirements, food and housing insecurity, but also things like racism and discrimination, the historical and ongoing harms of the healthcare system, culturally unsafe care, and one that I think not many people consider, which is the re-traumatization of uprooting relatives from their homes, their communities, their culture, their loved ones, and requiring them to relocate for like every 2 weeks, every 3 weeks, for a month, 2 months, several months at a time. 99% of the barriers that I encountered as the Indigenous nurse navigator were not a result of a person or an individual's decisions, but rather it was a result of systems in place around us which are rigid, impersonable, and near impossible to navigate at times. When I was thinking on what to share about the positive impact of the Indigenous nurse navigator role, I considered listing out general themes like relatives reporting feeling better supported or having a better understanding of their care, which are important, but I think it's one thing to see it listed out on a page in bullet form, but it's another thing to hear actual tangible examples. And so there was one relative I supported where I really struggled to reconcile with their outcome. And that was that they passed away from an advanced cancer before getting a biopsy confirmed diagnosis or ever stepping through the doors of Cancer Care Manitoba. When I received the news that this relative had passed away, my initial thought was that I had failed them. I wasn't aggressive enough with advocating for their appointments to be moved earlier in light of their, at the time, presumed advanced cancer. I was too slow in figuring out a reliable method of communicating with them since they didn't have a phone of their own. It quite honestly tore me apart because I treated every relative I supported as I hoped someone would treat my loved ones. And after sitting in this shame spiral for a few moments, I called one of their siblings to offer my condolences and let them know that if they needed anything, I was still there. And they shared something with me that changed my entire perspective on success and the impact of the Indigenous nurse navigator role. They told me it's people like you who help people like my loved one. Whenever you would call the house for them, they would go into the other room to talk to you. And when they would come back out, they'd have a big smile on their face. And they'd tell us, that's Chantal. She's my native nurse at Cancer Care. You see, I was stuck viewing success through a very colonial lens. You get people diagnosed and you get them to treatment. I wasn't seeing it through that relational lens. I wasn't fully grasping that sometimes it's just knowing you have someone part of your team who gets it, who understands your lived experience, someone who calls to check in regularly to make sure you're doing all right, but also sometimes just to share a laugh. And this relative and I, we laughed a lot. Lessons I've learned from the relatives I've supported as the Indigenous nurse navigator are innumerable and have been life-changing. When I consider all I've learned from relatives in the context of the healthcare system and cancer care, one truth sticks out to me. While the system has come a long way, we still have a long way to go. In full transparency, as much as I cherished my time as the Indigenous nurse navigator, it was also very heavy. When you're helping people navigate or overcome the same barriers over and over again, yeah, it's great to be able to help someone, but it becomes disheartening to not see any real change to eliminate those barriers rather than connecting to resources that will help people overcome them. It's disheartening to have the focus be on the person and what they can do or what resources they can tap into to overcome a barrier rather than taking a look at the system and addressing what puts that barrier there in the first place. This brings me to my new role as the Director of Indigenous Health. This is a new role at Cancer Care Manitoba. And I would say this role truly came to be thanks to the Provincial Indigenous Health Network here in Manitoba, which when I joined the organization as the Indigenous Nurse Navigator in 2024, I was invited to be part of as one of the Cancer Care Manitoba representatives in the absence of a formal Indigenous health lead or department. The Provincial Indigenous Health Network provides leadership, strategic counsel, and operational guidance for the delivery of culturally appropriate health and wellness services across Manitoba's health service delivery organizations. And people who sit as part of this network are, Indigenous health leads and team members. And one of the projects that we've been working on is the creation of an Indigenous health operating model, where one of the functions is to grow and sustain an Indigenous representative workforce through a combination of the Indigenous health operating model, some of our wonderful allies here at Cancer Care Manitoba. The Director of Indigenous Health role was identified as a vital role that needed to be created and posted. And this happened in February of this year, of which I was the successful applicant. I officially transitioned to the Director of Indigenous Health role on May 11th. So we are quickly coming up on 1 month now. I am still in the process of listening and learning. This is one of the aspects I've been very intentional with because I think there can be a lot of pressure to hit the ground running, especially in an area like Indigenous health, where there is so much that needs to be done. But I also think you can do a lot of harm by trying to rush into everything without first taking the opportunity to listen, learn, and build relationships. Overall, I think some of the most important things to me as I move forward in this role is ensuring the work is Indigenous determined and distinctions based, and that the work lasts beyond my tenure in this role and whoever comes after me and so on. I I find I always come back to the seven generations principle, which guides not only the work that I do, but how I conduct myself in everyday life. It's the principle that I am here today because of the seven generations that came before me, and the work that I do today must always be done with the seven generations that will come after me in mind. As I look ahead, it's easy to become overwhelmed with the sheer amount of work that needs to be done, as I'm sure is the case with a lot of the areas and contexts many of you work in as well. And one of the experiences that I find myself drawing back on is I recently had the opportunity to attend the World Indigenous Cancer Conference in Aotearoa, New Zealand, back in April. This conference brings together Indigenous researchers, clinicians, community leaders, advocates, patients, and survivors from around the world to experience a program that is grounded and rooted in Indigenous knowledge, Indigenous innovation, and leadership in cancer care and control. Needless to say, it was an experience that I don't think I will ever be able to truly put into words. I walked away from the conference feeling so inspired, and I took so much away with me. One of which is the revelation that as Indigenous peoples, the barriers and challenges we face are similar despite our geographic differences, which I think says a lot about the impact of colonization and the harms it's imposed on Indigenous peoples around the world. But my main revelation with this is that while our barriers and challenges are similar despite geographic differences, so is our love of laughter and our joy. Some other insights I walked away from the conference with is that equity and care in general is relational. Relationships are essential to advancing health equity, especially Indigenous health equity. Relationships provide a sense of belonging, trust, understanding, respect, and help contribute to growth. At the end of the day, advancing health equity is not solely about the services or supports we provide. It's how we show up with and for people. Trust, respect, and accountability really matter, especially in Indigenous communities where many of us are so accustomed to extractive, or as I recently heard it called, parasitic relationships, which are one-sided. Our knowledge, our lived experiences, and our resources are taken without really being given anything back. Lived experience is valuable and is a form of knowledge in and of itself. Relatives and families understand their realities in a way the system can't, and the needs to shape, and that needs to shape how we design care, not just how we respond to it. Another thing is that distinctions matter. Often, Indigenous peoples are spoken about as though we're just one group of people, but First Nations, Inuit, and Métis communities are comprised of a multitude of nations, cultures, beliefs, and our needs, histories, and relationships with the system are unique. Equity requires us to respond to that. And finally, centering Indigenous voices, not simply asking for input, but actually sharing power in decision making, whether that's at the bedside, in programs, or at leadership levels. Oftentimes, you will find that Indigenous peoples, communities, and nations already know what we need. We've just never been given a seat or a voice at the table. These are just some reflection questions that I put up. So, where are relatives or patients getting stuck in your system? Who is expected to navigate that complexity? Is it the relatives or patients, or is it the system? Whose voices are not present at the table that should be? And who is deciding what culturally safe care looks and feels like? Now, there's where might our good intentions be maintaining the status quo? And what is one thing within your control that you can change? Merci, miigwech. Thank you. I don't know if anyone has any questions, but open to it.
Thank you very, very much, Chantal. That was really incredible. And thank you for those reflection questions. I think we have a responsibility, right, to reflect on as people who are part of the system, whether that's in practice or decision making or policy or research, how we're contributing or how we're perpetuating some of these challenges. So thank you very much for a thought-provoking and insightful presentation. I have lots of questions for you, but um, I can ask one maybe to get us started, and then if folks have questions, you can either put them in the chat or put your hand up. One thing I was thinking about as you sort of told us about how the genesis of the role of Indigenous Nurse Navigator and then how you kind of took that on and made it your own. I was wondering if you could talk a little bit about, what were the challenges or hiccups that you experienced in terms of being the first person in a newly created role and how you navigated that.
Yeah, oh my goodness, I remember in those first days feeling so lost about, what do I do? And I was very fortunate that when I started, um, I'm based here in Winnipeg, and at Cancer Care Manitoba, we have a Winnipeg navigation group. So I think it was 4 or 5 at the time, other nurse navigators who work with general population, anyone who comes in. And I got to sit with them. So my office was with theirs, my desk was with theirs, and just having that support where, the nurse navigator piece, I was learning that and knowing I could just kind of like lean back in my chair and be like, I need your guys' opinion on this. So directing the practice in that way, it was invaluable to have that support, and to have sort of a general framework already built in what a nurse navigator looks like. And then really the main bulk of the work was figuring out how to incorporate that cultural aspect into it, that indigenous aspect. And really, I think my approach was just letting the relatives decide, because it's not up to me to say, well, this is what you need. It's like,
Mhm.
no, I'm going to sit here. I'm going to focus on building relationship with people, because I know from my own experience that whenever I interact with the healthcare system, I'm very nervous. I'm very apprehensive given past experiences. And so, taking that time to really intentionally build that relationship, um, was something I identified very early on as vital to this role.
Mhm.
Um, and just really letting the relatives decide what they need from me and who or what they need me to be. And
Mhm.
then doing what I can to either build a circle of care around them, build a team, um, or sometimes, admittedly, this was not healthy, but becoming that main support for them, which I tried to really work towards getting away from as I got into the role and realized how unsustainable that was.
Yeah, thank you. Does anyone else have something they'd like to ask, question, comment? I did wonder about, oh, go ahead, Leah.
Thanks for that presentation, Chantal. I was wondering, do you have a community of practice that you connect with, either other nurses or similar folks in um, I guess similar roles actually, because I know in BC here we have Indigenous patient navigators. They're not nurses, but we do have 4 clinical nurse specialists in the province of BC who are focusing on Indigenous cultural safety and wellness practice. Just wondering if
Nikki?
you have something across the country in terms of connection.
Yeah, I think I actually know one of your clinical nurse specialists, Nikki.
Yeah.
Yeah, so we don't have a formal community of practice for Indigenous navigators, whether nurses or not. I think my first venture into connecting with others in similar types of roles was through the work that I got to do with clinical trials. So there's a group of us who worked together to create a distinctions-based pathway to clinical trials access. The first pathway we worked on was the Métis specific pathway, and it was through that group that I actually met some Indigenous navigators in Ontario, as well as Nova Scotia, I believe, and Nova Scotia or Newfoundland. So that was really that moment for me of, oh my goodness, there's more of us. And I definitely would like to see a community of practice be put together because in often cases it's very isolating work at times. Um, and like being able to have that understanding of what it means to bring your culture into a role is, I think, so imperative to the long-term success of positions like this.
Mhm. Yeah, and what makes me think of this is Dr. Horrell and I co-led a scoping review looking at how equity was being conceptualized as a goal or aim across the Canadian cancer sector specifically. But one of the points that we raised in that paper was that in order to move some of these initiatives forward in a meaningful and like sustainable way, that it really needs a connected effort across the country. And I'm just thinking about some of the projects that I know are either underway or recently completed here in BC. So, for example, our director, which I'm not sure if you know him or not, Warren Claremont, might be
Mm,
somebody good to connect with in your new role. Their team recently led an evaluation that was funded through the Canadian Partnership Against Cancer for their Indigenous patient navigator roles. So I'm thinking I was curious whether there was a space and a connection of folks across the country that can come together to create that connected momentum and share either approaches to because I can imagine, and you pointed to this in your presentation, you know these kinds of this work and especially roles are very hard to, let's say, evaluate coming from a, Western lens, and thinking about how to do that in different ways that more aligns with Indigenous ways of knowing and being and knowledge frameworks. Um, Frameworks also being a colonial perspective. But, how do we work within that, within these systems that exist now? And just thinking that there might be a growing opportunity and how allies like Tara and I and others on the call can help support those efforts across the country and in different sectors as well, because I think that's a
yeah,
really important piece.
absolutely. Tara, you're muted.
Yes, I am. Zoom just reminded me that. There is a question. I think this is a question in the chat from Emma. You mentioned it a few times in different ways, but I would love to hear your thoughts about how the work needed might mean bringing forward different types of knowledges that challenge the status quo.
Let me read that again.
Maybe it's more of a comment, I'm not sure, but
Yeah.
if you want to add anything.
Well, and I'll just say, Chantal, you kind of,
Oh,
sorry, here I
There
oh,
am.
we
there we
go.
go. There we go.
Kind of alluding to it or saying it in different ways when you mentioned lived experience as important
Hmm.
knowledge, mentioning Indigenous concepts of health and wellness.
Yeah.
And oh, there was one other that jumped out at me too. Oh, just like a framework that values relational care, right? Those
Yeah.
are all concepts that I think, are pushing um, pushing what is the status quo right now. And even
Yes.
Leah's comment kind of is getting at it where it's if you have an evaluation system that doesn't see certain types of knowledges, then it won't be reflected, right? So
Yeah.
well, I would love to hear what you think about that, or if you have plans around that or anything like that?
Give away all my plans.
Okay, just your thoughts.
No, one thing that I will share is this is something that I'm looking into exploring more because I recently was accepted to a master's program. So I will be attending the University of Victoria virtually as part of their Master of Nursing Indigenous Wellness program. And that is the main area that I've kind of identified as wanting to explore further is how we get the system that is so baked into this Western colonial lens and get it to not only just value, but understand and really meaningfully incorporate other knowledge systems
Mm.
and to see them as inherently valuable to the betterment of patient experiences and outcomes and just how we relate to each other on a very human level.
I look forward to hearing more then as you
Yeah. I
progress
don't
in
know
your.
if that answers your question.
No, I mean, it sounds like you're going to be a scholar of this topic, so I'm looking forward to it.
I'm still a novice.
Thank you.
Thanks.
Anybody else with a question or comment for Chantal? Oh, Alicia?
Yeah, I might have a question, Chantal, because it's like this is going to be really important. I'm interested to see too how it unfolds more in terms of like the actual incorporation of like traditional medicines.
Yeah.
Because I find like for many, they come here and they need cancer care, but it's so pharmaceutical and westernized that when they're receiving their care, traditional medicines aren't usually even on the table for discussion. So, yeah, I'm interested to see how that starts to maybe change or transition, or your thoughts on incorporating that.
Yeah, absolutely. I mean, in my experience as the Indigenous nurse navigator, that was something I encountered a lot is, relatives who found it
Mm.
very important to their holistic well-being to be able to incorporate Indigenous traditional medicines and healing practices. And at
Mm.
times meeting a lot of resistance. Um, and I think it was just at the time on the like very down low, just, you know, letting them do what they needed to do, essentially. It's like they'd come to me and be like, well, my oncologist is telling me I can't do this. And it's like, well, they can say what they want, but you're still going to do what you need to do. So I think now in this new role, it's going to be about finding a way forward with that in a way where people don't feel like they have to hide that or have to not disclose that or feel ashamed or like it's not valid. Um, and I think that's going to require a lot of education within our own teams, um, and also a lot of collaboration and partnership with knowledge holders, traditional healers, and seeing them as what they are, which is a valuable part of the team. Tara, you're muted again.
Seriously. We'll give the last question of the session to Yinka.
Oh, thank you. I actually just wanted to say thanks for the presentation. I think some of the things that the indigenous community are facing are the same, like kind of similar to what the Black communities are facing. I would like an opportunity to meet with you sometime. Um, I can't remember. Is it Chantel? Um, yes, Chantal, yes. Yeah, I would like to meet with you sometime just to see. I know we have some similarities and how we can work together. This has been a good and a nice presentation. Thank you.
Absolutely. Thank you.
Well, thank you again, Chantal. Really amazing presentation and great dialogue. Thanks so much for taking the time to share with us today. And for others that joined, really appreciate you being here. We'll be in touch over the summer through our newsletter and then resume these every 2 months meetings in the fall. So thanks, everyone.
Thank you.
Thank you. Have a good day.